My name is Casey Cooper, and I'm the CEO of the Cherokee Indian Hospital. We're located in Cherokee, North Carolina, in the western part of the state. So I'll share this with you so that you can decide if you want to spend the next 6 minutes listening or not, right? So we started this journey because we have a very, very sick population of people that we take care of. As many people know, the Indian health system in this country is one of the most underfunded systems. So we are a level 3 NCQA. We've won some various directors, national and local awards, and have been recognized for excellence. But what I want to share with you today is the partnership that we developed with South Central Foundation so that we could really focus on improving the health of our population and reducing health disparities. And we reached out to South Central Foundation because they had developed a way to operationalize relationship-based care. We knew we would listen to Dr. Ann Bullock, who is the director of the National Diabetes Prevention Program for the Indian Health Service and one of the leading experts in this country on type 2 diabetes in Indian country. And she would frequently say to us, it's all about the stress. Show me someone with an A1C of 13, and I'll show you someone who's lonely and depressed. So we reached out to South Central Foundation, and they had developed an entire system around relationship-based care, and they really helped us to understand this. And I borrowed this slide from Doug Eby, who is the Vice President of Clinical Services. And there is this phenomenon in healthcare where there is a relationship between acuity and control. Where acuity is high, patients have no control, right? When they're in the ER with chest pain and ST elevation and elevated enzymes, we're going to knock them out, stick a tube down their throat, and we take over. But the majority of the time, to really impact population health, we need to be in primary care where patients have total control and acuity is low. And so what we say to our staff is that the fact that you are board certified and licensed means that you are minimally qualified to work in this health system. To be effective, you also have to be influential. And to be influential, you have to demonstrate genuine empathy and compassion for patients, and you have to build influential relationships. So this is our strategy. We're going to endeavor to improve the health of the population while controlling cost per capita by getting greater patient-family engagement. And we think that patient-family engagement is a function of the relationship that they have with their care team. And we think that that relationship is founded on trust. Trust that is a function of compassion, core competencies, continuity, consistency, and consultation with minimal power differential. So here's the other thing that we learned from South Central. We completely redesigned our systems because a traditional healthcare system is sequential and interdependent. You walk in, you check in, you sign a form, and you wait. You get put into a room, you have your vital signs taken, and you wait. A provider comes in to see you and works up a treatment plan, and you wait. And if you need to be referred to another specialist, you have to exit that system and enter another sequential interdependent system. So if you're an elder and you need to see oncology and the vascular surgeon and the hematologist, and you need to see, or if you're a diabetic and you need to see vascular surgeon and cardiology and a number of other specialties, you have to navigate through all these sequential interdependent systems. And when you fail, we just decide that you are non-compliant. And we say that it's not a reflection on the care that we're providing. So we redesigned the system so that it's reciprocal interdependent, and you have to do this by co-locating your key primary care resources and eliminating the bottleneck. Right now, the traditional system has the provider as the bottleneck. Everything goes through the provider, and it's not necessary, and it's terribly inefficient. And in the new system, the way South Central designed it and the way we have implemented it, you have parallel work. So every member of the team is able to work in parallel, and you have embedded behavioral health workers, you have embedded clinical pharmacists, embedded registered dietitian. They are sitting in cubicles where they're in a huddle all day, and the system is designed to be reciprocal and interdependent, and it's not fancy, but that's what it looks like. So in this system, you have an entire primary care team sitting in the middle with a primary care provider. The primary care provider has an assistant. You have a registered nurse case manager in the back of the pod with case management support and embedded shared resources like the clinical pharmacist, the registered dietitian, and the master's level therapist. This is an expensive primary care system because all those resources have to be engaged to wait. So if they're going to really respond to the patient who said they need a med refill, but they have a positive PHQ-9 and they need to see a master's level therapist today, you have to have a therapist who is engaged to weight that can respond. And it's expensive, but we are betting that it'll pay off in the future. After you connect the pipes, you have to build culture. We teach 100% of our employees our organizational culture because we can't make the assumption that everybody understands empathy and compassion. And so we literally teach it with a program that we call Duyuk Dan, or the right way. The right way is founded on 4 guiding principles: Uwashan, Udantethlan, Tohi, Nihi, Tzatzeli, and Digwatzeli Iyunsti. The very first one, Uwashan, Udantethlan, means to give from your heart. It means that the person who's receiving service from you genuinely understands that what you're doing comes from the depths of your heart. Tohi means to be in balance, to have a relationship that is in balance, not a paternalistic relationship where patients subordinate their health decisions to someone. It's a healthy, balanced relationship. Nihi Tatseli is this concept that it belongs to you. American Indians in this country have the very first pre-purchased health plan. We are stewards of their inheritance, and we manage it that way. And then finally, Digwatseli Iyunsti, which means to be like my own family. Right? So for a patient to say that my caregiver is like my own family, they have the influence of a member of my family. So we have these trainings. It's very expensive. It takes 3 days to teach this, but we endeavor to have 100% of our employees through this training because we believe that you can connect the pipes and change the processes, but without the organizational culture to accelerate those change, it is ineffective. And again, we are the Cherokee Indian Hospital located here in the beautiful mountains of western North Carolina. Thank you.